My name's Aryan. Today I'm going to be talking about DNRs. In other words, do not resuscitate orders. I'm often going to call it DNR short. Now, what is DNR? These are often forms that are filled out by a doctor, and when these forms are filled out for a person, this means that they, in the case of the heart stopping, such as a cardiac arrest, the medical professionals will not administer CPR. And this is often done in advance of an emergency, so when you would come into the hospital and diagnose you with certain diseases that could possibly stop your heart, they would have this conversation. And it's imperative that you remember that this doesn't mean that you can't receive other forms of treatments. And an example of this is over here. How it varies from different healthcare institutions, but they're always easily recognizable, as because also there's some wristbands that some people use in healthcare care homes. Yeah, they use some wristbands so they can easily see whether they can administer CPR if the heart would stop. And there's also other short form versions like DNA CPR, which means do not attempt cardiopulmonary resuscitation. Now, to understand why people get DNR in the first place, you need to understand what actually happens during CPR. Most of you know the general mouth-to-mouth that would happen, and chest compressions, which could cause breaking of ribs and other bones. And to kickstart the heart, you also have a defibrillator, which would give you electric shocks. And to make sure your airway stays open, as when you're unconscious and your heart is stopped, there's no pressure that's keeping your airways open. Breathing tubes are quite literally shoved down, and this is very painful afterwards, and it isn't something that you want. Often the person also vomits, which isn't as well known as other facts, and this happens because the breaking of bones that happens during chest compressions pushes down on other organs within your body, which causes food to be pushed down. And the extent of this is quite a lot, as there's a risk of them drowning in their own vomit. And the simple solution to this is tilting the head and letting them release all of it. And my general point I'm trying to get across with this is that CPR is a very violent process, and in addition to that, it doesn't have a very high success rate, as even within the hospital, there's a success rate of only 20%, and that's accounting for there's medical professionals that know how to CPR and done it many times before. There's defibrillators at easy access at every point, and people are always monitoring. So even though these all factors come into play, it's still 20% success rate, and that's not accounting for other factors that could reduce it, such as old age and the other conditions that could also be there. Now, what is the purpose of DNR? As I mentioned before, CPR is a very painful process, so it may be a way of alleviating suffering for the patient, and also doctors may give DNR if they believe that there's a low success rate due to them being old and having other conditions. And it's also important that we have DNR so it maintains autonomy for other patients, as it's one of the three pillars of ethics within medicine: autonomy, beneficence, and non-maleficence. And it makes sure that they always have a choice of what their treatment is throughout their life. Now, who is involved in the decision? So if we were patients, we could make this decision at any time we want, and this would involve us going to the doctor, having discussions with them, and reasons why we want to have this. And it would be up to them at the end of the day to decide as well. However, there's also ways you can make it legally binding. This would mean that later on, if you don't want DNR right now, you could have it later on when you are incapacitated or couldn't be able to make a decision, just in case. And there's also one more way that you could do it, which I've written here, called LPA, a law power attorney, which is someone you would choose to make decisions for you, and this could range from more than just DNR. And you could also back out of this at any point, because this is just a form of making sure that you have choice within your treatments. But this will all be recorded in your medical history so they can see it fully. There's also other ways it can be given. It can be given by the doctor, and the doctor does not need your consent to do this. However, they are obligated to give you the opportunity to understand what you mean by DNR and why you've done this. And it's also very important that the doctor accounts for the patient's wishes and what they want in their life and their treatments. However, there are some cases where they do not need to tell them this extra step, as there may be people who would still disagree, and this could lead to more strife and cause them physical and psychological harm. Now, there's certain rules when a doctor gives DNR to patients. They have to do it on an individual basis, meaning that they have to focus it on the patient's needs, what they want, and their own problems that they're facing within the hospital. And due to this main point, they can't give DNR to just a group of people just because they're all of a certain age and they all have a low success rate if they were to have CPR performed upon them. And this can range to other factors such as age, medical condition, disability, race, or language. Now, why are DNRs issued? So in a case study that was conducted from many patients that hadn't chosen to have DNR, they had chosen to have DNR, sorry, they had these reasons for choosing it in the first place. So they may have believed that the pain associated with CPR, as I mentioned before, was too much for them to handle, and they may have the quality of life they were currently going through may have been so poor that they didn't want CPR, as it may have been escaping death, as that's another reason which is more philosophical. And they also may, as during CPR you're unconscious, however, if you were to survive it, you would still feel all that pain afterwards. They fear the pain and quality of life that they have afterwards. And there's also some social factors to this as well, because you'd be burdening, they believe they put some burden on the family, the stress of going through the entire process. And a doctor would normally give DNR in the case that they believe that it wouldn't prolong their life, or it may cause them more harm than benefit. And this would be weighed up by multiple factors, such as the suffering that they would go through, and whether the success rate of CPR, of them living afterwards. Now, within DNR, there are some multiple problems with it, as DNR discussions often fail to satisfy the criteria for informed consent. As in Tolsky's and colleagues' analysis of tape-recorded DNR discussions led by medical residents, they found that only 4% of residents discussed the chances of survival after CPR, and only in vague qualitative terms. And this often means that as doctors have lots of medical records, they can often easily have a percentage or number value of what's the survival rate of patients. What they normally do as well, there's something called the gold standard, in which they rank patients based on green, amber and yellow on how much time they have to live. Green meaning they have a few months to years left to live, amber meaning they have months to days, and red meaning a few days to hours. And often they shy away from revealing such facts about the actual number value of what's their chance. And this poses a big problem, as patients often get a false, unrealistic view of what CPR actually entails, because not talking about this may result in them not talking about the other key factors within CPR and the things that happen to them within it. And this is also a problem that's related to mass media portrayal of CPR, as within movies and stuff, they show it as being more successful than it actually is. As people within this case study were seen to believe that CPR wouldn't be as painful as it actually was, and thought that the success rate was closer to 50%. And another problem is that DNR discussions often happen too little or too late, as a study of 500 patients who suffered from cardiac arrest showed that 76 of these patients with DNR orders were incapacitated to make decisions at the time the DNR order was discussed. However, only 11% were impaired at the time of admission. And this is a big problem due to the fact that this forces their families or surrogates to make the decision for them, and as they aren't as aware of what's the situation for the patient, it may cause them to not make the right decision for the patient and what they actually want, as they often will believe that the patient can suffer through more pain than they actually can, as they want the best for them at the end of the day. And another problem that also with DNR is healthcare professionals inappropriately extrapolate DNR orders to other treatment decisions. And this is often when they believe that just because they have a DNR, other forms of treatment may not be required because it wouldn't be medically beneficial, or they're assuming that just because they have a DNR, they wouldn't want other forms of treatments. And this problem arises from them not having enough conversations, as they may believe that there's not enough time for them to have a conversation, they're anyway going to die. Or they may believe that having this conversation they may feel that it's more uncomfortable for them to have this conversation. Thank you for listening.
Do you have a DNR?
No, I don't have a DNR.
Why not?